Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. You know, as we get older, stiff, aching joints can kind of become a daily struggle. It makes it harder to do the things that we love and move around. Is it normal aging, or is it a sign of something more serious, like maybe arthritis? We're talking about that today with Dr. Cindy Pinson. She is Valley Health Section Chief for the Center of Senior Wellness. Thank you so much for being here.
You're welcome. Thank you for having me.
Yeah, joint pain is something that a lot of us deal with. So is it just part of normal aging, or is it something that we can fight a little bit?
Well, I think as we age, there are going to be some pain that comes into our joints that we've never had before. How do you know if it's normal or not? Usually middle age, 40 to 50s, we start having some aches and pains. But maybe some stiffness in the morning, to kind of go away once you get up and you move around, and that's usually okay. What will be worrisome will be there are other signs that comes with it, like if there's warmth or some swelling around the joints and it doesn't really go away when you do your normal over-the-counter medications, Tylenol, ibuprofen, naproxen, whatever you're trying to take. If they don't go away, then that could be a more serious problem.
More like a red flag to watch for.
Yes.
What about pain that wakes you up at night? Is that a situation that you need to watch for?
Pain that wakes you up at night is always a really bad thing. So you definitely need to talk to your doctor about that. That includes pains in any kind of joints or even in your muscles that are associated with your joints. Those are always bad signs.
Okay. We've heard of arthritis. We've probably heard of osteoarthritis and just joint pain. What's the difference between all of that?
So let's hit the arthritis first. So arthritis is short for osteoarthritis, and that's what we commonly call it wear and tear. When we age into middle ages, we often can have some pain from just having used the joint for a while. But in fact, there's actually not only one single reason for osteoarthritis. There are multiple causes of it. So it's not just because you've used it a lot. For joint pain, that can happen with maybe just walking too much one day or going to a football game and going up and down the steps or going on a hike. So those are temporary joint pain. They can happen to anyone or even some injuries from a fall or overuse, and that can all go away. But the things that we're worried about are symptoms that continue to stay and worsen.
So how do you evaluate for that? What does a patient visit look like when you say, everything is just kind of achy and hurts?
I break it down to some questions as, where is this, or what's the location, and how did this start? What is the nature of the pain? Is it sharp? Does it only hurt when you do this or that? What makes it better? What makes it worse? So those are some of the basic questions I ask.
When people have problems with this, they often want to take a pill or try anything to make it go away. So what are some of the treatment options? And then what are some of the lifestyle things that we can do that really can make it better for us without taking anything?
So over-the-counter medications are very effective for joint pain. Let's just call that in general. Tylenol is very helpful in the beginning stages of it, and people like anti-inflammatories would be like ibuprofen, naproxen, Aleve, any of that stuff, and you have to take it with caution, of course, but they're helpful. Then there are these topical ointments now that you can buy that you can rub on your joint, and it does help as well. So those are the over-the-counter stuff that people can start with. And then when you see the doctors, of course, there are other medications that they can give.
What about lifestyle changes, and how important is it to keep moving?
It's very important. If there's one thing we want to say to our patients, always keep moving. No matter how little you think you're moving or how much less you think you're moving now than when you were in your heydays, just keep moving. That is the best for heart health, for brain health, and it's best for your joints to keep going.
When do you talk up to patients that maybe medication's not the route and maybe it's time to consider joint replacement?
The surgeons always say when you have tried all the injections, the pills, and lifestyle changes, and you hurt so bad that every day you hurt and you wish you wouldn't have to walk, that will be the time to consider surgery.
Dr. Cindy Pinson, thank you so much. Some great tips for folks knowing that they don't have to just suffer with joint pain. We sure appreciate you today.
You're welcome.
Thanks for checking in on Monday Health Minutes.